So for step one, we're going to be using mouth tape alone while you sleep to keep the mouth closed so that we're forcing you essentially to breathe from your nose. Some of you may favor your mouth while you're sleeping and not even know it. Or if we try to get you to breathe from your nose, you may be unable to tolerate it. And if you do, it might help you, or maybe you feel less comfortable. One way for us to find out is to try it out. So, somewhat like a mouth. Step two, we're going to be looking at keeping our nasal airway open by looking at whether or not you are having difficulty keeping your nose, basically your nostril, open at night. Sometimes, just because of position, gravity, or just the changes in airspeed, your nasal valve may not work well. It may collapse, and it may just not allow air to flow in when you need it. So we're going to test this out. First, without doing any mouth tape. So I want to say all by itself, how do you do? The idea here is how you position it is really important, because if we come in real close, essentially your nostril here is a cartilage, and the septum is the wall against it. And so for folks who are collapsing, it's the nostril that's falling in against the septum, and that's no good. So what we want to do is we want to try to give it some support. So if you don't place it right, it won't do anything. So the idea here is that you get your nasal strip, and you have a sticky part over here. You basically, when you're looking at the nose, you want to see where your tip is, and then your bones are higher, and you really want it right in between there. All right, and so it should really kind of cover this area of the nostril, and they're pretty generous. So basically, just do a little something like that. Give it a little sort of tug on there. And the idea here is that these strips are wanting to straighten itself back out. And so because I've placed it properly, right where we want it, it's pulling on my cartilage, pulling it open. And so if I change my position or go one way or the other, I want to see if holding it open changes how you feel.